to Mayo Clinic Dermatology. My name is Hafsa Cantwell.
And I'm Kirk Seide, and we're the two co-chief residents for this academic year. Several of our residents will be taking on a virtual tour of Gonda 16.
We look forward to showing you around.
Hi there, my name is Jenna Aird and I'm a PGY2 here at Mayo Clinic Dermatology. Welcome to our fantastic program located here on Gonda 16. This is one of our hallways for the outpatient setting. There's 4 different hallways, and each morning you're assigned to a different hallway with a different consultant. We use the light system here, which is a very nifty system that allows you to communicate with our incredible nursing staff. And I'll go ahead and show you what a typical patient room looks like. This is one of our typical patient rooms. They mostly all look the same. When you come in, your patient will be sitting ready for you. You can always use one of the computers as access to our Epic online medical system. And then during your patient encounter, you're able to have access to all of these pamphlets, which allows you to give your patients some education material so that they can take home. So this is one of our clinic workrooms. So this is where you'll be before you go see patients. You'll be with other residents as well as consultants, and it's a great learning opportunity to all be together to talk about patients, to review patients ahead of time, and discuss them before you go in. And we use a system of name tags. So in the morning you'll grab your name tag, find your computer, whatever computer you want, and then start out your day. The nice thing here at Mayo Clinic is we use something called the Fluency option. So it's a recording option for writing your notes, which makes notes a lot faster, and it's a really fantastic system that you're able just to use like a microphone like you would in radiology. So this is our medical photography suite, where patients can come back and you can take full body images and also do some of the mole mapping that we can do here at Mayo Clinic. This is an awesome benefit because you can have patients come back, do full series of photos, and you have really incredible quality photos that you can look back at time and time again over the years. Another really nice benefit here at Mayo Clinic Dermatology is that every single resident has their own medical administrative assistant. That assistant helps you with responding back to patients, looking at lab reports, sending out pathology reports, and a myriad of other issues that come up in the day-to-day practice of things.
Hi, my name is George Monitor. I'm one of the second-year dermatology residents here at Mayo Clinic. I think one of the strengths of our program is the number of training resources available to us as residents. We're here in our phototherapy suite, where we have a number of full-body phototherapy cabinets, narrowband, broadband. We also have UVA1 phototherapy, hand and foot units, among others. As a first-year resident, you spend time here in the phototherapy suite to learn how to dose phototherapy for our patients and how it works, along with the hospital rotation, in which we help manage patients who are admitted for Geckerman therapy, which involves phototherapy. I think it's a real strength of our program. I'm here in our multi-headed scope room on Gonda 16, which can accommodate 18 learners during normal times. We often use virtual Zoom sessions with our slide scanner for derm path education these days. In each year of the residency curriculum, there's dedicated time for derm path, along with a weekly education session. Overall, I think it's one of the real strengths of our program. I'm here in our laser room on Gonda 16, where we have the opportunity to perform ample number of laser procedures. In here we have 3 lasers. We have our XLV, diode laser, and pulse dye laser. We have the opportunity from day one to work with our dermatologic surgeons, cosmetic dermatologists, and pediatric dermatologists to gain familiarity and experience with using each of these lasers. We additionally have a CO2 laser on the surgery side of our floor. We have an excellent cosmetic curriculum overall, with both a didactic component and hands-on exposure as well.
We are fortunate to have a robust hospital service here. As a first-year resident, we spend 6 weeks at the Rochester Methodist Hospital. There, we care for a unique inpatient dermatology service where patients are admitted for full-body wet dressings to the dermatology service. In addition, we cover consults from the hospital from either oncology or specialty surgical services. As a second-year resident, you spend an additional 6 weeks at the St. Mary's Hospital, covering emergency room consults, pediatric consults, and any other inpatient consults at the hospital.
Hi, I'm Jake Stewart. I'm a PGY3 dermatology resident here at the Mayo Clinic, and I'm here to show you our MOHS surgical suite. Let's take a look. This is one of our procedure rooms. We have an excellent space here to work with our nursing staff as well as our dermatology surgery consultants. With state-of-the-art equipment, we're also able to have hands-on experience and be able to see in person. Here on the back, we have our inking stand, where we help ink the MOHS mapping specimens. We have wonderful lights, cautery, everything you need here available in our MOHS surgical suites. Here's where we do our MOHS readout. We have 4 multi-scope usage areas, all with computers, and here we're able to read out with our consultants all the MOHS slides, as well as be able to review pathology from various cases throughout our clinical rotations. Let's take a look. Here we have 4 multi-heads, each with 4 on each scope, with wonderful lighting adjustments. We have wonderful staff as well to help if you ever have any questions or concerns. Welcome to our MOHS lab. We have it's early in the morning, but our technicians are hard at work getting ready for our MOHS day. Here we have the cryostats. We're able to process the frozen tissue for each of our MOHS slides. Around the corner, we also have state-of-the-art equipment for our special stains, where we do special staining for melanoma as well as poorly differentiated squamous cell carcinoma, all in an automated fashion. Really some of the best that we can see. We're now here in our resident workroom. This is an excellent space where we're able to work on patient notes, other education, as well as to build camaraderie and esprit de corps. We also have, not pictured, next door have an area for the 3rd years with about 8 other computers.
On behalf of the Mayo Clinic Department of Dermatology, thank you for taking the time to explore our program.